Hey guys, Dr. Dave Bergmann here at Rosemary Jones Chiropractic, and this week we're going to be talking about degenerative disc disease, or more commonly known as arthritis, something that we see very frequently here in the office. So we start here with the normal vertebra, and we go to phase 1, phase 2, and phase 3. So we start here. The disc is normal, and in the normal stage, normal healthy disc vertebra, and there's alternating segments all the way down. Now when we've got that nice healthy disc, it creates a space here where this nerve can leave from the spinal cord. And when we turn and twist and move, there's plenty of room for that nerve to move around him without there being much irritation on that nerve. Now when we go to phase 1, we start to lose some of that space. We lose some of the fluid out of that disc, and there's a general bulging there, and it's becoming thinner. So not only are we losing the height of that hole, we're also losing some of the diameter. And now when we turn and twist and move, there can be more irritation on that nerve. There's a lot less room for error when we start to lose some of that disc space. In phase 2 here, this is where we start to see some of the arthritis, the bone spurs. What people really think about when they think of arthritis is kind of these jagged edges on the bone. The disc is very thin. We're losing a lot of fluid out of there, and there's not a lot of space for that nerve to come out now at all. So now when we turn, twist, move, much more easily affected when we turn and twist and move. When we see people at this phase, they're most of the time in a lot of pain. Not always. But they typically have consistent pain throughout the day. When we get into phase 3 here, the bones are almost fused together. We've lost almost all the fluid out of the disc. We're really not in a healthy state here. There's not a lot of room for that nerve to come out. Chiropractic can times have an effect at this level, but if it gets to this point or even a little bit worse, you're typically a surgical candidate at this point. Now this process occurs over time. So to go from normal to phase 1, phase 2, and phase 3 can be 5 to 10 years, 10 to 20 years, and 20 to 30 years. So it happens over a very long period of time. But it doesn't necessarily have to happen because you're getting older. That's a very common belief, because I've taken x-rays where there's a normal segment and a degenerated segment right on top of each other. And if that was the case, that it happened because you're getting older, it should all be normal or it should all be degenerated. There shouldn't be mismatched segments there. So what happens is the degeneration starts because there's some restrictions in joint mobility, there's misalignments of the spine, there's decreased stability of the muscles in those areas. So what chiropractic does is identify where those areas are, either by our palpation, our exam, or an x-ray, and we can identify where you are in this process and try to slow or stop that process from occurring, because once you've started, there's nothing we can do to get that to go back in reverse. At that point, we're just managing what you have. So it's something that a lot of people don't even know they have, because it happens over a long period of time. So you don't necessarily need to have symptoms to have degeneration. We've taken a lot of x-rays where people were pretty surprised that they had that much degeneration in their spine without having the symptoms. So if you tune in next week, next Tuesday, we're going to be actually taking a look at x-rays, real x-rays of people that have come in, and show you what normal x-rays look like and what a degenerated spine looks like and the difference with that. So I encourage you, if you know anybody that has the degeneration, or if you think you may have some arthritis in your spine as well, certainly ask any questions if you have them. Otherwise, tune in next week and we'll go over the x-rays. So again, I'm Dr. Dave Bergmann here at Rosemary Jones Chiropractic, and thanks for listening.